Welcome to this Step 2 clinical knowledge review on difficult conversations test-taking strategies. This video is brought to you by Roadmap to Residency. We are going to break down the most common question patterns you will see on your board exam for breaking bad news, disclosing medical errors, responding to angry patients and families, and cultural competency. The goal here is not to reteach the entire topic, but to help you recognize the patterns and apply test-taking strategies. Make sure you have reviewed the ethics and communication sections of first aid and your question bank before or alongside this video. Here is what we are going to cover today. First, we will learn how to recognize high-yield question stems for difficult conversations on the boards. Second, we will apply specific strategies for questions about breaking bad news, disclosing medical errors, responding to angry patients and families, and cultural competency. And third, we will master the most appropriate next step question format for these communication scenarios. This video assumes you have some baseline knowledge from your review resources. We are here to sharpen your test-taking approach. Our first strategy is the breaking bad news framework. When you see a question about a physician who needs to deliver a serious diagnosis, immediately ask yourself what the correct first step is. The answer is almost always to explore what the patient already knows or understands about their condition. This maps to the well-known framework of setting, perception, invitation, knowledge, emotions, and summary. On the boards, the wrong answers will try to tempt you with jumping straight to explaining the diagnosis, ordering more tests to delay the conversation, or referring to a specialist before telling the patient anything. The correct answer puts the patient's understanding and emotional state first. Make this your go-to mental framework for any breaking bad news question. Strategy 2 is all about medical error disclosure. The boards test this in many different ways, but the answer is always the same. When a medical error occurs, you must disclose the error to the patient directly. Tell the patient what happened, express empathy, and explain the steps being taken to address the issue. The wrong answers will try to tempt you with options like only documenting the error in the chart, blaming another team member, waiting to see if the patient is actually harmed, or telling the patient that everything is fine. Every single time, the board expects the physician to take responsibility and communicate honestly. This is one of the most straightforward rules on the exam once you know the pattern. Here are the 3 most common STEM patterns you will see for difficult conversations on the boards. The breaking bad news STEM puts you in a scenario where a patient is about to receive a serious diagnosis, and the question tests whether you explore their understanding first. The error disclosure STEM describes a medication or procedural mistake and tests whether you disclose it directly to the patient. And the angry patient STEM describes a family member or patient who is upset. And the correct approach is always to acknowledge their emotions rather than becoming defensive or dismissive. Recognizing these patterns early in the question will save you valuable time on exam day. Let us work through our first practice question. A 55-year-old woman with a history of chronic cough undergoes a chest scan that reveals a lung mass. Biopsy confirms non-small cell lung cancer. The physician enters the room to discuss the results. The patient says she has been worried about the scan. What is the most appropriate initial response by the physician? Take a moment to think about this before we walk through the answer on the next slide. Let us break this down step by step. Step 1. Spot the pattern. A physician needs to deliver a cancer diagnosis and the patient has expressed worry. This is a classic breaking bad news scenario. Step 2. Apply the rule. The board rule you must memorize is: always explore the patient's understanding first before delivering information. Ask what the patient already knows. This establishes a foundation for the conversation and follows the setting, perception, invitation, knowledge, emotions, and summary framework. Step 3. Eliminate wrong answers. Explaining results in detail first skips the perception step. Reassuring the patient that cancer is treatable is premature reassurance that minimizes their concerns. Referring to oncology before discussing avoids the conversation entirely. The correct answer is B. Ask the patient what she understands about why the biopsy was performed. Here is our second practice question. A nurse informs the attending physician that she accidentally administered 10 times the prescribed dose of a blood thinner to a hospitalized patient. The patient is currently hemodynamically stable with no signs of bleeding. What is the most appropriate next step? Think through this one carefully. The key here is what the physician's obligation is to the patient when an error occurs. We will walk through the answer next. Let us work through this answer. First, read the question carefully. This describes a medication error where the patient received 10 times the intended dose of a blood thinner. The patient is stable right now, but that does not mean you can ignore the error. Documenting the error in the chart without telling the patient is insufficient because the patient has a right to know. Filing an incident report without informing the patient also violates transparency standards. Reprimanding the nurse addresses team management but not the patient's needs. Now, why does disclosure always win on the boards? Because the ethical and legal standard is to inform the patient about the error, explain what happened, express concern for their well-being, and outline the plan for monitoring and correction. The correct answer is B, inform the patient about the medication error. Let us review cultural competency for the boards, because this comes up in many different scenarios. When a patient declines a recommended treatment based on cultural or religious beliefs, the correct answer is to respectfully explore their concerns and provide information without pressuring them. The physician should ask open-ended questions to understand the patient's perspective. This is about respecting autonomy while ensuring the patient has the information they need to make an informed decision. The wrong answers will try to tempt you with overriding the patient's wishes, calling for a psychiatric consult when the patient is clearly competent, or ignoring the cultural concern entirely. Also know that the boards consistently test interpreter use. Always choose a professional medical interpreter over a family member when a language barrier exists. A child should never serve as an interpreter. Here is our third practice question. The daughter of an elderly hospitalized patient approaches the physician and says angrily that her father has been waiting for over 2 hours for pain medication and that no one seems to care. She demands to speak to a supervisor. What is the most appropriate initial response by the physician? This is a classic angry family member scenario. Think about what the first step should be before trying to solve the problem. We will walk through the answer next. Let us break down this answer. The classic pattern here is an angry family member confronting the physician about perceived neglect. The question asks for the most appropriate initial response. Spot the pattern. This is a communication and empathy question. The board is testing whether you will acknowledge the emotion first before trying to fix the problem. Now, the key distinction. Making excuses about busy staff is dismissive and will escalate the situation. Paging the supervisor immediately without addressing the concern avoids the conversation. Telling her the medication is not due ignores the emotional distress entirely. The correct answer is B, acknowledge her frustration and ask her to tell you more about her concerns. On the boards, always lead with empathy. Here is a critical test-taking pearl about communication on the boards. When a language barrier is present, always use a professional medical interpreter, never a family member or untrained staff. The only exception is a true medical emergency when no interpreter is available. A child should never serve as an interpreter under any circumstance. These are consistent rules that the boards test in many different question formats. Also remember that a competent adult patient has the right to refuse any treatment, even life-saving treatment, as long as they understand the consequences. Informed refusal requires the same elements as informed consent. The physician must explain the risks of refusing, the benefits of the recommended treatment, and the available alternatives. These details come up frequently on exam day. That wraps up our review of difficult conversations, test-taking strategies for Step 2 clinical knowledge. Remember to review the ethics and communication chapters in First Aid and your question bank. Focus on breaking bad news frameworks, error disclosure protocols, cultural competency, and patient communication strategies we covered today. Visit www.roadmap2residency.com for expert tutors and residency advisors who can help you build a personalized study plan. If you found this video helpful, please like and subscribe so you do not miss our next board review session. Good luck on your exam, and we will see you in the next video.